I'm Mishona. I am Sofia Fabiguinat as Marieza.
And I am Marex S. Matarando.
And today we're going to discuss the chapter 6 of the bioethics, which is the ethical consideration in nursing leadership and management. Now let's jump in to the introduction of the chapter 6, which is the ethical leadership in nursing, noting its rise in popularity over the last 2 decades. It emphasizes that ethical leadership involves creating a positive work environment that supports high quality, cost-effective care and ensures nurses' conduct aligns with established ethical codes. Effective ethical leaders act as role models, applying ethical standards to daily practice and actively addressing ethical issues. Furthermore, it highlights the importance of an ethical climate, which is fostered by these leaders and significantly impacts nurses' moral distress, courage, organizational commitment, and ultimately the quality of patient care.
So here's what you can expect in this chapter. The theoretical foundation of ethics in nursing leadership, case study analysis of an ethical dilemma in healthcare, application to nursing practice and code of ethics, our key takeaways and reflection questions.
For the learning objectives, first is to explain ethical principles, explore foundational theories guiding nursing leadership, and second is to apply decision frameworks to navigate complex nursing dilemmas with practical tools, and lastly is to reflect on responsibilities, cultivate accountability and integrity as a future nurse leaders.
And now let me discuss the first two key ethical concepts, which is the moral decision making and the principle of moral discernment. When we say ethical decision making, it is a core competency for nurse leaders developed from clinical expertise. The purpose is to measure confidence levels in leaders using a defined framework. There are four phases of competency. We have moral sensitivity, knowledge application, creating an ethical environment, and lastly promoting social justice within the healthcare system. Now let's focus on the first phase, the moral sensitivity. When we say moral sensitivity, this is the foundational phase, where a nurse leader recognizes a situation as having moral or ethical implications. Next to that is knowledge application. Now, when we say knowledge application, this involves understanding ethical principles, legal guidelines, and professional standards, and knowing how to apply them to a clinical situation. Third is creating an ethical environment. This phase moves beyond individual decision making to establish a workplace culture where ethical issues can be openly discussed and resolved. And lastly, promoting social justice within the healthcare system. This is the highest phase, where the nurse leader takes action to address systemic inequities and advocate for fairness in healthcare access and delivery. The second key ethical concept is principle of moral discernment. A consensuous ethical decision is achieved by following four steps. First is be consensuous. The individual must be committed to being ethical. This means willing to do the right thing regardless of personal convenience or desire. Next is proceed on the basis of a fundamental commitment. The ethical choice must be grounded in core, unshakable beliefs, a commitment to God and to human persons according to their God-given and gracie human nature. Third is to choose actions that promote fulfillment. This identify actions that lead to the fullness of that commitment. Lastly, to exclude contradictory actions. These eliminate any potential actions that are intrinsically evil.
Okay, for the principle of well-formed conscience. What is conscience? The word conscience comes from the Latin conscientia and French conscience, meaning the internal sense of right and wrong, and one's ability to choose and act according to what is right. It is a practical judgment of reason that guides a person to do good and avoid evil. Importance in nursing ethics. Conscience is the cornerstone of ethical nursing care. It serves as an inner moral compass that warns, guides, and motivates nurses to uphold ethical and human values practice. In nursing, conscience is seen as an authority, a warning signal, and a sensitivity and burden. For the authority, it means that it directs moral action. For the warning signal, it alerts wrongdoing. And for the sensitivity and burden, emotional weight of ethical care. Okay. When nurses follow their conscience, care is authentic and compassionate. Ignoring it may lead to a troubled conscience, guilt, or moral distress. A well-formed conscience. So, a well-formed conscience allows individuals to make correct moral decisions through responsible reasoning. Steps to moral responsibility. Ayan. First is to inform oneself learn all relevant facts and moral norms. Next, to form a morally certain judgment, discern what is right or wrong based on reliable knowledge. Third is act according to conscience, follow what reason and morality dictate. Lastly is to accept responsibility, be accountable for one's decisions and actions. What ethical leadership means. Ethical leadership in nursing refers to the ability of nurse leaders to guide and influence others through moral integrity, empathy, fairness, and honesty. It combines ethical competence with effective management, ensuring that both patient care and staff welfare are respected. And attributes of ethical nursing leaders. First is empathic interaction, building trust, solving problems humanly. And second is to ethical behavior, fairness, cooperation, and moral integrity. Lastly is exalted manners, honesty, humility, sincerity, patience, and tolerance. And that's all.
Now let's proceed to the ethical theories and frameworks that guides nurses for ethical decision making in healthcare. So we have deontology, utilitarianism, and principalism. So this was discussed by the past reporters, so we're not going to deepen them. So next we have the Hamrick and Delgado's framework, which is the moral sensitivity, knowledge application, creating an ethical environment, and promoting social justice. So when we say moral sensitivity, it is recognizing ethical situation and dilemmas, knowledge application, applying ethical theories and principles, creating an ethical environment, fostering a culture that supports ethical practice, promoting social justice. It is where advocating for equitable healthcare and societal well-being. To fully understand the key concept that I have discussed, let's apply it to the case study analysis. It's a busy Monday morning at San Isidro Provincial Hospital, a government-funded facility serving both urban and rural patients. Nurse Supervisor Alisa, a senior staff nurse newly promoted to head nurse, receives a directive from the chief nursing officer. Due to budget cuts, all departments must reduce nurse-to-patient ratios from 1:6 to 1:10 starting next week. No overtime allowed. Alisa knows her ward is already short-staffed. Her nurses are overworked and patient complaints have increased. Last week, an elderly patient fell because no nurse was available to assist in time. Now, Alisa faces a moral dilemma. Should she follow the order to comply with hospital policy and budget rules, or she oppose it and risk conflict with administrators, even possible suspension to protect patient safety? So the case study is all about the unsafe staffing order. So after having our case study, we're now going to identify the dilemma. Since the reason for the stuffing is due to the budgetary mandate, now the focus of Alisa is the operational strain towards her nurses. Now the moral dilemma is to either follow the order or risk the patient safety. Now let's balance the situation. Let's focus on the beneficence. You have to act for patient good. You have to prioritize safety and quality care. Since you're a nurse, you are subjective to give a quality patient care. Next is the justice, fairness in resource allocation and workload distribution. And lastly, the fidelity, loyalty to professional ethics versus management directives. Now, if we anchor this to the moral decision making, the answer for that would be Alisa should propose the incident report that happened the past week. So this would be her evidence that the stuffing would be a problem towards the patient and the nurse. Now, by doing this, Alisa is complying towards professional ethics and moral ethics. Moral ethics because you are preventing harm to your patient. You are focusing on the ideals towards your patient. Now, professional ethics. Upon giving the evidence to the nursing chief officer, you have that clarification that this could be a problem, not just by the patient but to the nurses. We're also focusing on the nurses side. Now, the whole point is that Alisa should propose something that would prioritize safety and quality care to the patient, proposing organizational structure that would implement resource allocation and workload distribution, and of course, complying to the professional ethics and management directives that goes along together. Now let's focus on the ethical decision making and framework that has been done by Alisa. The phase one, which is the moral sensitivity, she recognized potential harm, which is the safety of the patient if the ratio would be 1:10. Now the phase two is knowledge application. She reviewed the organizational policies and proposed the incident report that happens last week, which is the fall of an elderly patient. Now we have the phase three, which is creating an ethical environment. She fostered open team discussion that the ratio would be a problem, not just the patient towards the patient, but for the nurses. Now, the phase four would be promoting social justice, advocating for equitable condition. This would ensure that the patient has its safety and, of course, maintaining its dignity while also upholding professional responsibility.
For multiple perspective, first, patient's perspective. So safety concerns, fear of medical errors. Second is timely care, delays impact to health, and declining quality, anxiety over reduced standards. Second is to staff nurse perspective, exhaustion, physical and mental fatigue, overwork, high patient to nurse ratios, and fear of mistakes, compromise patient safety. And Alisa's perspective is first is moral distress, conflict of ethical duties. Second is torn loyalty, order versus patient and nurse well-being, and ethical dilemma, no easy right choice. And lastly, for the perspective is hospital admin's perspective, budget constraints, funding limits, maintaining operations, ensuring service, and the resource allocation difficult decisions to make. And for the ethical conflicts and tensions, we have first is moral distress. Knowing the morally correct action, facing institutional barriers and inability to act ethically due to pressure. Next is moral courage, willingness to act ethically, and advocating for patient safety and despite potential personal or professional risks. And cultural factors. First is pakikisama, emphasis on social harmony. Second is utang na loob, deep depth of gratitude and challenges in questioning authority figures. So pakikisama is pakikisama sa patient and sa mga sa imuhang team, and utang na loob for the institution. And for the ethically justified solutions, first is patient safety advocacy. Engage in constructive dialogue backed by evidence to ensure optimal patient care and outcomes. Second is flexible staffing plan. Propose a compromise staffing model with flexible scheduling and a strategic redistribution of nursing staff. Third is consult ethics committee. Seek impartial guidance from the hospital ethics committee or nursing council for complex ethical considerations. Fourth is to foster open communication, support staff morale, and facilitate transparent dialogue through regular meetings and feedback sessions. Lastly is to implement monitoring and feedback. Establish a robust systems for continuous monitoring and feedback on staffing changes and their impact. And for the ethical justification summary, patient safety is the beneficence, prioritizing patient well-being and proactive risk mitigation strategies. Fairness and fidelity for professional values, advocating for equitable care access and upholding integrity and trust. And third is moral courage in advocacy, demonstrating resolve in ethical dilemmas backed by evidence-based practice. And lastly is alignment to Philippine Nursing Code of Ethics from the guidance from the Article 4 Responsibility to Society and Environment, and Article 5 the research directs ethical practice, and this ensures the compliance and the ethical conduct of the institution. And
So application to nursing practice. So we have ethical practice and leadership. So this involves using your moral judgment and creating a supportive work environment. So when the nurse is facing moral dilemmas, nurses must rely on their well-formed conscience to make decisions that are both ethical and compassionate. For example, like respecting a patient's refusal and treatment. So prioritizing patient value. So the focus shifts from simply doing a lot of work to achieving the best possible result or the value. So we have focus on outcomes in the 3 C's. So we have supporting the UHC law and access. Nurses play a key role in making the universal healthcare law work on the ground. This help fight financial fear and the bahala na fatalistic attitude that delays treatment. So fatalism is a philosophical doctrine that holds that all events are predetermined and therefore inevitable. So it encourages a passive, sometimes resigned approach to confronting difficulties. On the Book of Adan, it is stated that this mentality drains the healthcare system because it contributes to problems like shortage of healthcare workers, limited facility access, and high out-of-pocket expenses. So people often wait until a health issue is severe before seeking help, making treatment more complicated and costly. So to conclude our topic, conscience is indeed the moral soul of nursing, shaping both personal integrity and professional ethics. A nurse's conscience transforms routine care into authentic, compassionate service. So when guided by a well-formed conscience, nurses not only uphold patient rights, but also strengthen trust and moral credibility within the healthcare system. Ethical leadership, rooted in conscience, ensures that decisions are made with empathy and justice, even under pressure or uncertainty. So the ethical foundation is essential to successfully implementing the modern shift toward VBHC by focusing on meaningful patient outcomes, specifically capability, comfort, and calm. So it ensures that resources are allocated, effectively moving beyond simple cost-cutting